This episode of CareTalk is brought to you by BetterHelp. If you've been thinking about starting therapy, there's never been a better time to give it a try. BetterHelp offers online therapy that's accessible, flexible, and tailored to your needs. Whether you're dealing with stress, anxiety, or just looking for personal growth, BetterHelp connects you with licensed therapists who can support you on your journey to becoming your best self. Never skip therapy day with BetterHelp. Visit betterhelp.com/caretalk to get 10% off your first month and take the first step toward improving your mental well-being. That's BetterHelp, HELP.com/caretalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Tom Furr, founder and CEO of PatientPay. The company helps providers collect what they're owed without alienating their patients. Welcome, Tom.
Hey, David. Thanks for having me.
Why do providers have challenges collecting patient payments, and how does PatientPay help?
Yep. Medical groups, hospitals have been raised having to really focus on their insurance payments, not patient payments. I mean, it wasn't too long ago when patient payments were a small part of their revenue. And so they've implemented lots of technology on the back end to help with their insurance payments. And unfortunately, they haven't done the same on the patient payment side. So there's still a lot of paper statements that people send out. They will hope you mail back maybe a check. They will maybe give you access to a portal that's normally hard to log into, hard to pay. And so what PatientPay has done is to help these medical groups and hospitals enable technology that's very similar to what you do today on Amazon or any other places that are out there. So we give these folks the ability to get data out of their systems easy and efficiently, create a bill that's easy for the patient to understand. We built our system around the patient so that if multiple groups are, a patient's going to multiple different groups, they can get all of their bills in one place and can pay them with the same credit card or HSA card. So in essence, what we've done is it's not really rocket science, but we've taken what's out in the market outside of healthcare and moved it into healthcare so that patients have the same experience in healthcare as they have outside of healthcare. And by default, we can raise collections by 50 to 100%. 70% of the payments being made through PatientPay are done through the mobile device. So we're seeing all of the type results that you would see outside of healthcare now move into healthcare.
So it sounds great. And my question then is, why is PatientPay merging with ClearGauge?
So PatientPay has a great billing and payments platform, but they did not have an estimation and eligibility solution. They did not have a PayFac solution. So ClearGauge had the ability to bring us some technology we didn't have, which includes the estimation and eligibility, the PayFac. They also were in different markets than we were, but very similar. So they were in chiropractor, we were in PT. They were in a couple of different areas. We were in radiology. So the ability to leverage each other to become bigger and better really made total sense when you look at it both as standalone companies versus both coming together. And so we're very pleased that we were able to put together a deal. We're very pleased to start working with folks at ClearGauge to offer our respective solutions to the market. And we're having good response so far, not only from our existing clients, their existing clients, but new ones that have been calling into us.
What's different about the patient payment environment now compared to, say, 15 years ago or so when you started up the company?
Yeah, so pre-Affordable Care Act, we used to hear, I write off patient payments. I don't really need to collect them. I just need to send a piece of paper out because the government says I need to send at least 2 pieces of paper out. I don't know if that was fact or fiction, but that was kind of the response that we would get. And so today, post Affordable Care Act, the high deductible plans that patients are signing up for with their insurance company are driving more out of pocket dollars. And it can be 20 or even 30% of their total income that they get from patients. So when you write off 20 or 30% of your cash that's coming in, it becomes a cash flow issue. And so what we've seen is that people are now, medical groups, hospitals are waking up to the need of offering solutions that are very similar to the market to help them collect more of those dollars, but still have a good experience with the patient. And you collect more of those dollars by having a bill that you can understand. Hopefully you can append the EOB like we do with the bill. You have it easy to pay. As I said, 70% of the payments that we get on our platform are done through the mobile device. So if you offer payment plans, you do all the things that you would expect to do, easy to understand, easy to pay, you get more payments. And not only do you get more payments, but you get patients that are happy. They're not upset about getting a bill and being shocked or surprised that they got the bill. They're having challenges paying it, or they got a call during office hours to pay it. You kind of have to meet patients where they are, in our opinion, with easy to use solutions.
That's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Tom about his life and career. Tom Furr, CEO and founder of PatientPay. Thanks for joining me on the latest HealthBiz Briefs.
Thanks, David.